most famous physical therapist on the internet.
Hi, folks. I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
And together we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
We really have a solid argument for it, right?
That's right, Bob.
Today we're going to talk about tennis elbow. 2 proven self-treatments to stop pain in minutes.
Absolutely, Bob. Now, these are very exciting to me. One I just learned a couple of years ago. The other one even more years ago, but
You've had this yourself.
Oh, yeah, both arms.
Oh,
Yeah,
wow.
not at the same time.
Okay.
But anyway, we'll talk more about that.
By the way, if you're new to our channel, please take a second to subscribe to us. We provide videos how to stay healthy, fit, pain-free, and we upload every day.
That's
also,
right.
go to bobandbrad.com, go to the giveaway section. We're actually giving away a massage gun. This might come in handy later, Brad.
Yeah, the Q2.
Yeah.
It is. You know, this is the one I recommend to people my age because it's easy to hold on to.
Sure.
You know.
Good point. People that are 100 years or older. You can also go to facebook.com, and Bob and Brad will have a contest pinned to the top of the page.
Right up
Go
there.
to Twitter, Instagram, or TikTok if you want a 60-second version of our program.
That's right. And also, we are on podcasts now. I was just listening to the one with Dr.
Ekstrom.
Ekstrom, yes, very nice.
On the intercept. method,
Yep,
right?
new back pain procedure.
Yeah, very promising.
Yep, absolutely. So, Bob, shall we continue with tennis elbow? I've had tennis elbow. I've treated many, many people as patients with tennis
I
elbow.
have not had it, but I have treated many people. I take that back. I did have tennis elbow. Yeah.
But I have to admit, myself or none of my patients, I don't think any of them played tennis.
Right. And I wasn't playing tennis at the time either.
It just got I think people who do play tennis are prone to get it because these muscles that
You really overgrip them.
yeah, control the wrist and the grip. And the backhand is where those muscles is where that's going to get stressed. And for other people who don't play tennis, it's from various things where you're gripping. It's a repetitive motion oftentimes. In my case, it's like a weekend warrior thing where I work on a project and I'm gripping things a lot. And it just wears it out in the next, Tuesday or whatever. It's like
suffer.
Yeah, when you get a real point tender, the symptoms are it can be painful with pronation, supination, gripping. When you just touch it, because where the muscles connect to the bone right there, it's like with me, it's always about the size of a dime. Or for a patient, I'll start pushing around and I'll get to that tender spot and they pull away.
Aren't you? I think people are shocked, Brad, how much it can hurt. I mean, they think something is seriously wrong because it really hurts.
Yeah, if you walk through a doorway and you accidentally bump that into the door jamb, it can make you say bad words. Wow, it's like, whoa, that's not fair, I
had it when I was 23 years old. I know you want to know this. And
no,
I was a waiter while I was going to school for physical therapy.
Yeah,
and I couldn't hold trays.
Did you drop stuff?
Well, I had to go like this.
Yeah, so you compensated.
Yeah, I compensated.
Mm-hmm. So that's a good way to avoid irritating it if you can compensate. Yeah, if it is really flared up, I personally, and I have my patients, cold pack and rest it where you're not using it and see if you can get it to settle down. Obviously, avoid things that really irritate it because it hurts. You just use common sense on that. The first one, and this...
Yeah, last year, my friend, he actually got tennis elbow from playing golf, but he had to stop playing last year. That's how bad it was.
Yeah, well, that is serious.
So I'll tell you in a minute how I helped him.
Okay, good. The first one that I really like, this one, is the positional release or strain counter strain. And what we're going to do is put these muscles in a maximal relaxed position, and we're going to hold them there for 90 seconds. First of all, go to the tender spot and rub over it and get an idea. And I just did this with actually Chris's son. He's a baseball player. Sure. Well, he was. Now he's going back to hockey. But anyways, I said, rub over that area and give me a pain level. And he did it. He said
like
it was
from
7.
10. Okay.
10 is the worst. It's really painful. It's like, oh, it's at a 7. So then we did the positional release. So you want to relax the arm. And sitting in a chair with a backrest is better than what I have here, but we're not going to change for that. Relax that arm, and we're going to bring the wrist back. This is my good hand. This is the arm that's involve the painful elbow, and I relax the muscles, and then I'm going to turn my wrist one way or the other, and you have to experiment with this. Wherever you find a position where it feels the most comfortable, and you may have to bend the elbow, and usually with mine, I'd get it right about in here. With Zach, it was a little bit differently, but it was clearly relaxed. It felt good. Set a timer.
When he's in this position, the muscle is on extreme slack.
Right. Yep.
So
it allows the muscle to relax, but you
Right.
have to hold it in a relaxed state of mind and position for 90 seconds, no less. They've studied this.
time it out.
Yeah. Actually, yeah, I would have a timer, and they say 90 seconds to 120 seconds.
Yeah.
So a minimum of 90.
You're fine in going longer.
Yeah, exactly. Yeah. When you hit your point, let go, but don't let it pop back like this. Slowly let it come back, and then you're not going to do anything aggressive with that arm for the next hour or so. And then you can do some massage, which we're going to show a little bit more on that our next treatment, on the muscles. Don't go directly over the sore spot, but you can assess where you assess first time. I pushed down, it was a 7/10. You know the treatment was successful is if you push over it in the same spot with the same amount of pressure, and let's say in Zach's case, it was 7, it went down to 2.
Oh, wow.
Yeah, it was significant. It's like, so I had him do that. I said, every 1 to 2 hours, repeat this. He was playing baseball. He was getting back, and
Sure.
he had a game to play in a couple
Sure.
days. And it was successful with him.
I was totally shocked about this, Brad.
Yeah, I was
the first
too.
time you showed me this, and you showed it for my hip flexor,
Oh, that's right.
and I was like, it's better. It's like gone. And it was gone for quite a long time too.
Did you keep doing it?
No, I didn't. But
Typical therapist.
It doesn't bother me really anymore. Maybe the one time was
forgot
enough.
about it.
It's so weird.
So we better get on the number
Yeah.
2, cross friction massage. We do have a video on this we made, I don't know, 6, 7, 8 years ago.
Sure.
Back when we were in the basement of that one place, remember?
Right.
We're
So what
pretty-
happens is you get scar tissue that happens over the tendon.
Yep.
And as you start to use the muscles, you can break that scar tissue back open again.
Yeah.
So we want to massage the area, realign the fibers. That the scar tissue could be aligned like a spider web. We want to realign them. I don't know if that's really what
Well,
really
it's just an analogy
Yeah.
to get things so they're strong and pain free.
Right.
We know it works. We
Right.
can't give you the exact details.
Nobody knows really what happens.
So what you're going to do, the fibers go this way. You're not going to go on the really painful spot unless you tolerate it. But the key is I'm going to go this way, not this way, but this way.
Brad, I would probably use the pillow. For
Yeah, that is a good idea. And we're going to get into that. And you may start a little distal or further away from the elbow, and you work your way up. After 30 seconds on doing this, if it doesn't feel better or kind of a numbish feeling, then it may be too early, or you got to back away.
If it starts getting worse,
Yes.
when you're doing that,
Yeah.
then it's too much, too
Yeah.
soon. You might want to ice for a while. You might
Yeah.
want to do the other one that you showed.
Strain, counter,
Strain,
strain.
counter,
Yep, the
strain.
one we just finished
Yeah.
up. And you're going to do this until your fingers get sore.
Right.
Usually 2 or 3 minutes and my fingers have had enough. And usually that's enough, but they say you can do this for up to, what is the doctor?
Well, he was doing like 15, 20
What's
minutes.
his doctor?
Dr. I'll come
Guy-
back.
Can't
We haven't
believe
said his
we're
name
falling
for,
apart
We haven't
upstairs.
said his name for 30 years. So
But he's the orthopedic.
father orthopedic medicine.
Right.
It'll come to me. Yeah.
Yep.
Just give me a few more minutes.
But now, because the fingers are getting numb, we found that with
Cyrax.
thank you.
James
Gosh,
Cyrax.
I'm glad we're both kind of in that
Yeah.
same stage of life. We're going to go back and forth like this. These guns, these new massage guns, reciprocate. Okay, they have travel going back and forth like that. You put the round head on there, and then you're not gonna pound into it. You're gonna turn it
Right.
sideways,
Right.
and then you get that cross
fiber
friction benefit.
Action.
Yeah. And I'm telling you what, you can do it a lot longer, and your fingers don't get near as tired.
Right.
Um,
And I also, in addition to that, Brad, actually, the friend that I had who has tennis elbow from
Yep.
golf, I actually have him massage these muscles before he goes out for a match which really warms him up.
Sure. Yeah.
And also after.
Yeah.
And he's been doing that. He's been golfing all summer. No problems.
Yeah. This is one of those things that, we just did a video on the stretch bands, but I was thinking about the football player. Can we remember his name? The quarterback. He's 44 years old. Tom Brady, and he talks about supple muscles.
Right.
And that's what keeps him going.
Exactly.
And at his age, playing such a high aggressive
He talked
sport.
about how much his body was in pain before he did these things.
Yeah.
And he uses a foam roller quite often.
Right.
But this is similar.
Yeah. He hires masseuse.
Right.
Too.
I'm sure he does.
That's probably the best way to do it if you can,
right.
afford
you can afford
it.
This is our masseuse right
Yeah.
now, a massager. So.
All right,
Brad,
so very
good.
good. No, I really think that between those two, because they're different kinds of treatments, you're going to find success, and you can do both of them. Your tennis elbow is going to go away. You can go back to playing tennis or whatever you're going to do. There are some strengthening exercises that are helpful. We're not going to get into that here, but you can do Bob and
You
Brad.
would definitely start with this stuff.
Yeah, or tennis elbow pain strengthening.
Golfer's elbow, tennis elbow could be the same thing.
Yeah. I wonder if you could get tennis elbow from playing golf.
I bet you can.
Yeah.
I bet you can.
Then it would be golfer's tennis.
There
All
we
right.
go.
Take care.